Good morning. Today I'm going to talk about colon cancer. I'm briefly going to go over the cause, symptoms, risk factors, diagnosis procedure, treatments, and prevention and maintenance of colon cancer. How does colon cancer form? To sum it up, I've put a picture on the slide and it's showing the stages of the polyps in the colon. We all have polyps. And over time, some people may get a buildup that sits on the lining of the colon, letting the cancerous cells form. So, what are the symptoms of colon cancer? To start, unexplained weight loss, discomfort using the restroom, discomfort in your abdominal area, bleeding or black stool, and diarrhea. It's common for colon cancer to not show any symptoms in its early stages, making it challenging to detect early on. What are some things that put us at risk for getting colon cancer? One big thing is lifestyle. Having a sedentary lifestyle, like truck drivers or office jobs, just off the top of my head, lack of exercise, being overweight, low fiber diets, lots of drinking alcohol and smoking, grilled and fried foods, and being above the age of 50 greatly puts you at risk of developing colon cancer. But that doesn't mean that anyone under the age of 50 can't still get it. How is colon cancer diagnosed? There's two ways that colon cancer can be diagnosed, and that's by a colonoscopy and stool tests. Now, a colonoscopy is where the doctor will use a instrument that has a camera at the end that's going to go inside the colon, and they're going to look for any abnormalities inside the colon to see if there's any cancer. Now, the stool test is when they'll take samples of your stool and they'll probably put it under a microscope and check to see if there's any cancer in that. So, after you've been diagnosed, what are the treatments for the different stages of colon cancer? For stage 0, the treatment is to remove the cancer. For stage 1, the treatment is to remove the cancer and maybe part of the colon. For stage 2, removal of part of the colon and the infected tissue is necessary. For stage 3, removal of sections of the colon or lymph nodes followed by chemotherapy is protocol. And for stage 4, since the cancer has spread outside of the colon, surgery to remove parts of the colon may not work. So they can remove cancer in the lungs, liver, and the lymph nodes, and follow up with chemotherapy to prolong your life. After someone's undergone treatment, how do they maintain their lifestyle? One is to stay active. It's important to stay active. It's important to have a healthy diet. You would want to check in with your doctor regularly, get screenings often to make sure that if it does come back, you can, tackle it before it gets worse into the later stages. And possibly consulting your doctor about taking a baby aspirin can help lower the chances of you getting colon cancer again, or in general. What are some complications that arise after treatment? Some complications that people might get after chemo is neuropathy in the fingers and toes. And I've spoken to some people who have undergone chemo, and it's not something nice. Trouble using the restroom, diarrhea, constipation, not being able to hold in your waist. Those are some issues. Prevention. How can we prevent ourselves from getting colon cancer? lifestyle is a very important factor in this. You want to stay active. You want to avoid sitting for a long time. Consult your doctor about that baby aspirin. Eat healthier. Eat healthy fibers. Maintain a healthy weight. Try to take it down a notch on the smoking and the drinking, even though we're college students. Drink water often. And an important note is that our gut has millions and millions of microorganisms that help us stay healthy and digest our food. So that's something to think about. You're not only helping yourself, but you're helping them to help you. Thank you.